Okay, hello. First, we're gonna start with the shoulder girdle. And so first we have the clavicle right here. As you can see, we have the sternal end, which is right over here, right by the sternum. So it connects right here with the SC joint, sternoclavicular, and then we have the acromial end right here, which connects with the acromion, and then we have the AC joint right here in the middle that connects both of those. Next, we've got the manubrium, which is right here in the middle, the top of the sternum, where the SC joint attaches. And then we have, if she turns around, the scapula is going to be right here on her back, and as we can feel that, we can see that the lateral border is going to be right over here on her lateral side. The medial border is right over here, and then we have the inferior angle right here, and then the spine of the scapula is going to run right up along here. And then if she turns to the side right here, we can see the acromion and coracoid process. So the acromion process is going to be right here on the shoulder girdle, and the coracoid is going to be right in here, and these are going to be where some ligaments attach to. And then we have the humerus, which is going to be all like right here, and so the head of the humerus is up here, and it attaches into the acromion process. And then the deltoid tuberosity is going to be, if we feel, if I feel right here for her deltoid, it's going to be like about right here where the muscle ends, and I can feel like the tension stop. So that's where that tuberosity is. And then we have the greater tubercle, which is going to be right here on the outer, more lateral side, and then the lesser tubercle, which is more on the inner side. And then the intertubercle groove is right in the center, and we can feel that like in between both of those grooves. And then we also have the neck, which is pretty small in the humerus, but it's just like right here, attaching the head to the shaft of the humerus. Next, we have the deltoid, which is the shoulder muscle. So it's going to be right here, and there's going to be the anterior aspect of it, which aids in flexion of the shoulder girdle, and then we'll have the lateral aspect of it, which will aid in adduction. If she raises her arm like this, right there, and that muscle is working. And then we have the posterior aspect also, which aids in extension of the shoulder girdle. And then we've got pectoralis major, which is going to be right here. And it has kind of like a wing, so it goes like this, and it helps to stabilize the shoulder girdle. And there's upper and lower fibers, which help stabilize that there. And then we've got the latissimus dorsi, which if she turns around again, we're doing circles. Oh wait, just kidding. That's the wrong muscle. Okay, latissimus dorsi is right over here actually, and that helps with stabilizing the abdominal muscles, and also it stretches up to help with the shoulder movements also. And then teres major is going to be right here, like in the armpit, and that's going to help with stabilizing and movement also. And then coracobrachialis is going to be kind of deeper, like here, right in the center, right by the teres major. Okay, and then we have the serratus anterior, which, wait, I'm going to have to put